Hello, my name is Ginger LeMay. I'm a clinical associate professor at the University of Rhode Island College of Pharmacy, and here along with Kelly Matson, clinical professor at URI College of Pharmacy, we'll be presenting a just-in-time for pediatric immunization video. This is co-branded by 3 different organizations: the University of Rhode Island College of Pharmacy, the Rhode Island Pharmacists Association, and the Rhode Island Society of Health System Pharmacists. This just-in-time video is to support pharmacists providing pediatric immunizations per the recent expansion by Health and Human Services, or HHS. It is not accredited for continuing education, nor does it provide extensive clinical information, such as the ACIP Pediatric Immunization Schedule. Information not contained in this video may be found at cdc.gov.
Thank you, Ginger. So the next few slides, I'll just be going over the conversation of how to prepare before the appointment, and then sort of some common tips for pediatrics and giving immunizations to children, particularly in that age group, ultimately to be able to have a better interaction. So here, this is just some information that you can give parents if they have questions before the appointment of maybe what they as parents can do to help prepare their child for the immunization. So giving them the information about what will happen, where it may be happening, particularly in the pharmacy, how long it might be, so that they can prepare if they need to be able to wait or something of that nature. What will be done during the appointment, specifically before and after the immunization. Questions, of course, children may have, well, how will it feel? So that you can have the parents talk that it may be a pinch or have a little pressure. And then when to sort of maybe to have that conversation about preparation. Older children, it will really depend on their chronic anxiety level. So if that they are anxious children, that you may want to prepare or have that conversation with them more likely you would with toddlers and preschoolers, much closer to the actual immunization time or appointment, given that maybe it might be the morning of, or even maybe on the ride to the appointment, to try to limit their anxiety. Next slide. So just some general information that we typically have with interacting with younger age children. Ultimately, always try to sit to meet their eye level. Use that normal tone of voice. And this goes even down to your toddlers and preschoolers when you are trying to have a conversation, that they much easier to have that interaction with that normal tone of voice. Remain calm and non-judgmental, and this really can be for all children, but when specifically looking to immunize adolescents, just trying to remain calm. A lot of times adolescents may be aloof or off-putting at times because that they're having sort of fear around that immunization, and that may be something that you just need to sort of think about and try to remain calm and non-judgmental. Give the child or adolescent your full attention, particularly when you're asking questions. Allow them to express concerns, and during that interaction, really actively listen to the child, what their questions may be, or even sort of their remarks that they may have. Next slide. So just a little bit about positioning. Typically with toddlers and preschoolers, we talk about caregiver laps. You want to have a firm hold, but really try to avoid excessive restraint. If it becomes where that they are more combative, that you may want to have them take a moment, walk around, try to diffuse the situation, and then come back to having that caregiver hold that toddler or preschooler in their lap. Never place the child supine during immunization, because that increases the pain around immunization. And then, of course, with school age or even adolescent, just having, of course, them to sit, no different than you would an adult, to avoid that increased risk of fainting. Next slide. One of the coping strategies that we talk a lot about within pediatrics are sort of the healthcare professional-led distraction. There can be many different distraction techniques that we'll go over, but this has really shown that if the healthcare professional leads that distraction, it helps to reduce pain and distress versus parent-led distraction. Parent-led distraction can be helpful at times as well, but comparatively, it really is better for the healthcare professional to do that distraction technique. So some things here, just with toddlers and preschoolers, you can sort of see the list: toys, bubbles, pop-up books, levers or stuffed animals, and really having that non-procedural talk with them, having them to talk about something maybe in the environment or their favorite book or toy, even maybe that levy that they've brought with them, really can help the immunization process go pretty smoothly. For school age children and adolescents, you're just sort of changing maybe a little bit of what you're talking about. For children, it may still be toys or books. But with adolescents or even older school age children, you may want to consider a joke or having them listen to their iPad or maybe play a video game while the immunization is happening. And then, of course, through that procedure, really maybe discussing something like their favorite movie or activity or even sport to sort of help that distraction. Allowing sort of those school age children and adolescents to be involved in that decision of which strategy might be helpful to them really kind of gives them ownership and helps with that coping strategy. And really, overall, most of these are truly effective in less than 7 years of age, because most of the time, by the time that they reach 8, 9, that they're able, if not anxious, ultimately to have their own coping strategies that they will have themselves. Next slide. Ultimately, too, having them, of course, take slow, deep breaths or blowing is a nice relaxation strategy, and this can work synergistically with distraction. So no different than we would do with adults, but ultimately just knowing some of those coping strategies and then working that deep breathing with them. A lot of times we talk about a pinwheel or something of that like with the bubbles that can really kind of use both of those coping strategies with distraction as well as the breathing. Always assess the caregiver's behavior as well. As you can see here, with a child's distress is really sometimes associated with caregiver's behavior or their distress around the situation. So helping that through the procedure and sort of having those conversations to provide family-centered care with the caregiver as well as the child. Of course, try not to tell the child that it will not hurt. This is not effective. It can be considered even deceptive because we know that it will hurt. But trying to have that conversation about maybe a pinch or pressure, and then having that conversation with them that, once that the Band-Aid is there, that it might hurt a little bit afterwards, but it shouldn't hurt for a long period of time, as well as do not apologize or criticize or give the child control during the procedure, or even try to reassure that it will be okay. This can always and has been associated evidence wise with associated distress within the child. So having those conversations, just giving them the information in a very direct way, but again, using the sort of those active listening techniques, being at their eye level, really in a calming manner can be helpful to cope with the situation. Next slide. So just a couple information about pharmacological approaches that could be done. An OTC lidocaine 4% cream or patch could be given. Now, one thing that, again, this may limit time because of the appointments that may be needed, that this is something that if caregivers ask about, yes, you could provide that education, but ultimately doing at the time of immunization could extend that appointment time and could add additional cost. So this is something you can be considered, whether it's within the protocol that you're doing within the pharmacy or having that discussion with a parent or caregiver before the immunization appointment happens. Skin cooling techniques such as vapocoolants, they're inexpensive, could be used beforehand, but the evidence shows that the efficacy is really uncertain. So it probably most likely wouldn't be really needed in this sort of situation. And ultimately, ice or ice packs such as Buzzy Bee Again, not effective and actually may have more perceived as painful just because of the true ice on the skin. Next slide. Lastly, I'll just kind of have a conversation, particularly around acetaminophen and ibuprofen. CDC recommendations, particularly for the COVID-19 vaccine, states that it can be taken if there is local symptoms or post-vaccination symptoms, but at this time is not recommended for routine prophylaxis as there's limited data on the effect of the immune response of the vaccination if given acetaminophen and ibuprofen as a routine prior to the immunization itself. And lastly, just a comment about epi. Of course, we need to have epi on as part of the procedure for an allergic reaction. In here, I've just given some weight recommendations for dosing: 10 to less than 30, a 0.15 milligram IM shot, and then 30 or more kilos, a 0.3 milligram IM shot. Next slide.
Now we're going to talk a little bit about the process of providing intramuscular injections to our pediatric patients. And for the purposes of this video, we're going to focus primarily on ages 3 to 9, as this has been the expansion under HHS. And for many pharmacists, immunizing a child down to age 3 is something that is new as a part of our scope of practice. One of the most difficult things about providing immunizations in general is that they can cause, we'll say, a disruption, so to speak, to the workflow. It's a wonderful part of the process, but it does require extra time, as it should. So one of the ways to make our workflow smoother is to prepare as much as we can in advance. So preparing your supply baskets in advance. And if that's not something that the pharmacist is able to do, it's something that the technician or the intern can be tasked with. Included in the supply basket would include a syringe if needed, if it's not a pre-filled vaccine. Most are pre-filled, in which case we would just be putting a needle on. And you can use anywhere from a 22 to a 25 gauge needle. And the needle length would be 5/8 to 1 inch. Children over the age of 3, the administration is in the deltoid muscle, as we will discuss, and the needle length can be anywhere between 5/8 and 1 inch, though 1 inch is probably adequate for most children in this age range. We also want to have an alcohol swab, a cotton ball just in case, and a bandage already prepared. And of course, you would want to make sure that wherever you're administering your vaccines, that you have some lollipops at the end. It is useful, if your pharmacy allows, to schedule appointments for vaccinations. So in some pharmacies, we have the ability to do that in advance. And even if that's an informal scheduling process at your place of employment, if you know that a family is coming in, oftentimes it can be difficult when a family comes in with maybe 4 or 5 children. So as much of the paperwork and the supplies you can have in advance will make that process even smoother. If possible, children who are nervous or maybe apprehensive, try to have them come at off-peak times. So obviously coming to a pharmacy at 5 p.m. is not a great time, as the wait may be longer. In terms of our caregiver or parent considerations, as Kelly mentioned, children are very perceptive to the feelings and actions that are projected by the adult caregiver that is bringing them in for their vaccination. So if the adult appears nervous, the child may feel nervous. And so it's also important that the pharmacist focuses on the caregiver or parent. They may have questions, so we want to be able to anticipate time for those questions. They may have questions about the vaccine ingredients, the effectiveness, and oftentimes the case method is a way to organize our thoughts so that we can help address caregiver considerations. Many of this information was derived from the pharmacy-based immunization for pediatric patient continuing education program, which is available at pharmacist.com. There is a fee associated with that continuing education program, but it may be another tool that will help with your training. CASE stands for, the C is corroborate. So in this situation, the pharmacist would acknowledge the patient's concern and find a point that you can agree upon. So showing compassion and empathy for how they're feeling in this moment. And then A is about me. So letting the parent or caregiver know that you are, quote unquote, a content expert. You've gone through the immunization training. Perhaps you've done extra training if you have watched this video or done any continuing education specifically related to pediatric immunizations. Describe to them S, the science. So what is happening on a local level and perhaps on a national level. And then explain or advise and make sure that your advice is science-based. Always listening, validating their concerns, being flexible, and encouraging their involvement in the process. Again, that would be age dependent. As far as being the immunizer, this can certainly be a potentially stressful situation. And some of these tips, so I always look at this as having different options in your toolkit. So you may not use all of these options, but you know how to use them when the situation arises. So one of the most important things is to control your own pace. Just like when we're dispensing medication or wherever your place of employment is, it is critical to be careful and accurate. So controlling your pace, not letting things get too fast, taking time for yourself as the immunizer to breathe. Relying on your team, you can't do it all. So although you may be the one providing the actual vaccine, all of the pre-work can be done by interns and technicians. Remembering the mission. So the mission is to protect this child from contracting an illness or disease. It can be very difficult as the immunizer when you see a child that may be in distress. And this is a new situation for many of us. However, knowing that after the shot, they're going to be, as Kelly said, they're going to be okay, although we have to be very careful in the way we communicate that to the child. So recently I had a young child who was 5 years old who came in with her sister to have her flu shot. And this little girl was not very pleased with coming in to get her flu shot. And after the vaccine, she was happy as can be. She actually came in her tutu. She was skipping around the pharmacy and everything was okay. So knowing that the mission is positive. Also keeping your safety the number one priority. So if you do have a child who is, we'll say, uncooperative, involving the caregiver, as Kelly mentioned, making sure we're using the right posture by having the child sitting on the lap and bringing their arms around for that gentle bear hug. That is the best way to keep the child and also you as the immunizer safe. And we will have some demo videos after these slides to show you some of those techniques. And maybe be the reason a child is no longer afraid of shots. Maybe some of us were really scared when we were younger, or maybe we're parents and we can really connect to these feelings. Let's try to make it our mission to make children feel more comfortable. So for the purposes of this video, we're focusing on intramuscular injection technique for ages 3 to 18. And again, this is administered in the deltoid muscle. Under the age of 3, it is recommended for the anterolateral thigh for the injection, but that wouldn't be performed for our purposes today. For older children, 1-inch needle is sufficient. So you can see from the picture here that we want to make sure that we get through the subcutaneous tissue and that we reach into the muscle. If a child is on the smaller side, a 5/8 inch needle may be appropriate. It's always important and critical that we use a new needle and syringe as we would. We want to make sure that it's long enough to reach deep into the muscle. It is inserted at a 90-degree angle, as you can see in this picture. And if they are receiving more than one vaccine, that we want to make sure that we separate those vaccines if they are in the same arm by greater than or equal to 1 inch and document appropriately. So at this point, Kelly and I have reviewed some of the basics in terms of approach to the child and approach to the parent and caregiver. At this point, we're going to switch into some live demo videos and provide some real life examples of how to put this into practice. We appreciate your time. Thank you.
So you're here for a flu vaccination?
Yeah.
Yeah. Have you ever had a flu vaccination before or a flu shot?
Yeah.
Yeah? Okay.
Well, we're here because we have to be here. I'm not happy about that.
You're not happy about that. Tell me why. Is it, have you had, he said he had it before. Is this something
Yeah,
Just tell me what you're feeling.
Yeah, he had it a couple years ago, but I mean, there's no flu. I mean, everybody's worried about COVID. I don't know what we're doing here. I mean,
Yeah.
they said he had to have it to go to school. It's like, I don't know what's going on.
I understand how you're feeling. I know, we're seeing a lot where, because of the mask and being social distance, that flu isn't really circulating as much. But I can say that, looking at the data, that the cases are rising now, and that it's really just the understanding to try to protect him in case that, those infections keep increasing. So it's just a precaution. You said he had it before. Did he do well with that, or was there any sort of reason why you're concerned for him to have it again now?
Yeah. I think he just had a sore arm.
Mm-hmm.
Yeah, he just had a sore arm. So I mean, it's not really him. It's just, we don't see anybody. We're separated from people. We wear masks. Doesn't. I mean,
Yeah.
I don't know why they're making us do this.
Well, it's just, again, the cases are rising, and ultimately it's something that, just from a protection perspective, with everything that's happening, that's sort of the mandate that they're having for school to have that flu vaccination. So I'm excited that you're here and that ultimately that you're willing to get it today. Are you okay with getting it today?
Yeah.
It hurt a little bit last time, you said?
Yeah.
Yeah. Well, it probably will hurt a little bit this time too, but we have lollipops, we have things to make it easier, we got a pen, we do really well at the end, so I think we could do it, don't you think?
Mhm.
Okay. What do you think, Dad? Do you have any other concerns?
If Nick's okay with that, I guess I'm okay with that.
Okay.
Thank you.
Hi, you guys. I hear you're here for your vaccination today.
Yep.
Yeah?
We're all ready.
We're all
Ready to
ready?
go?
Any questions that you guys have before we get into having you sit down?
I think we're all set. I think we're ready. My one concern is there's a lot of family members that don't want to become vaccinated. And how do I talk to them? How do I tell them how important it is for them to get these vaccines?
I think really having that conversation with them about the experience that you're going to have today, whether she does really well and sort of, it's going to hurt a little, but, understanding those kind of things and the hesitancy, afterwards, sort of how she does and explaining how she did, is really going to probably help them feel more comfortable on getting the vaccination. And for yourself included, like once you get the vaccination as well, if they're, as an adult, also hesitant, just explaining the situation and how well you did and sort of what we're experiencing, I think will help. And hopefully.
Hi. Hi. My name's Ginger. Nice to meet you, Vivi. How you doing today?
Good.
You doing okay? Hi, Mrs. Toast. How are you?
Good, how are you?
Good. How's she doing today?
She's a little scared.
Yeah, I understand. So what brings you in today? You here to get your flu shot? Yeah, have you had the flu shot before? Yeah, you have had it before. What happened when you got it? It hurt. Yeah. Sometimes it does hurt a little bit. That's normal. Feels like a little pinch, like you might get if maybe your brother or your sister kind of pinched you in the arm, and then afterwards it'll be all done. The good thing about the flu shot is it will protect you against getting sick. So it's a really brave thing that you did coming here to get your flu shot today. Okay. I'm going to show you what I'm using for the flu shot, okay? So we have, well, first of all, most importantly, we have some lollipops that we can pick out. So maybe you might want to start looking at them and thinking which flavor is your favorite. Okay, do you like strawberry or raspberry? You like that one? Do you want to hold on to it now? No? Okay. Well, we'll pick that out afterwards, okay? So we're going to go right into the upper part of your arm. So maybe Mom would like to pull down the top of your shirt a little bit. Perfect. And are you comfortable sitting on your mom's lap like that? Okay, wonderful. Well, the first thing we're going to do is clean your arm. So we're going to use this. This is an alcohol pad. Okay, hi.
Hi.
Are you Katie? Hi, Katie. I'm Ginger. I'm the pharmacist.
Hi.
Nice to meet you. Is this your dad? Hi, Mr. Bradberg.
Hello.
Pleasure to meet you.
Nice to meet you.
I see Katie's here to get her flu shot today.
Absolutely.
Awesome. That's great. Have you had your flu shot before, Katie?
Yes.
Okay. When was the last time you had your flu shot?
October probably.
Okay, perfect. Last year, October.
Mhm.
Yep, awesome. And how'd that go for you?
Pretty well.
Okay, good, good. Well, today we're going to give you your flu shot. It's going to protect you for the next year, so you'll come back again and get it next year. And even though we're wearing our masks and washing our hands, it's still important that we get the flu shot, as you know. But do you have any questions for me or any questions that I can answer for you today?
Nope.
Okay, great, awesome. Well, what I'm going to have you do is put your right arm. Is it okay if I do your right arm today? Great. I'll have you rest it right up there on the chair. Wonderful. And I'm just going to get my supplies set up here. We have our flu vaccine here. First thing I'm going to do is clean your arm with a little bit of alcohol. Okay, so I'll have you pull down your sleeve. Wonderful. And I'm going to clean it just like that. Excellent. I'll find my gloves. Hardest part of giving a flu shot for me is the Band-Aid. Great. So I'll put my gloves on. So what are you doing today? You on vacation? Nice. Do you have any plans?
Not really.
No. Did you get any Santa come to your house? He did. What did he bring?
He brought me Legos.
Oh, he did? What kind of Legos?
Like books and like this giant set.
Oh, wow. I love Legos.
Mm.
Do you put them together all by yourself or do mom and dad help you?
I put them all by myself.
Look at you. That's awesome. Great job. I'd love to see a picture of it when it's all done. You send it to me? All right, great. Well, when you were just telling me that story, you got your flu shot. It's all done. So, how would you like to pick out a lollipop now?
Yep.
Okay, what's your favorite flavor?
I like a lot of them.
Oh, well, you can take more than one.
I like this one and this one.
Perfect. Great. Well, thank you so much. I hope you have a wonderful vacation, and thank you so much, Mr. Bretberg. Have a good day. I'll just leave you with this.
Oh,
this
yep.
is our information about the flu shot. If there's any questions we can answer, just let us know.
Okay.
Okay,
Sounds good.
thanks.
Thanks so
Bye,
much.
Katie. Bye.